The topic is weight maintenance. Hello, I'm Dr. John. This is the last of a 4-part series on weight control. In an adult, weight gain is the result of fat produced from excess of food energy intake. Therefore, any restriction of food energy, either voluntarily or fasting or using medications, can result in weight loss. However, maintenance of weight will happen only if you provide the body with all nutrients the body needs on a timely fashion. And none of the weight loss or weight control mechanisms can achieve that, because only your brain knows what nutrients you are looking for at the time you are sitting down to eat. So, how can you ensure that you provide the body with all needed nutrients on a timely fashion? The first thing to do is eat when you are hungry. The second is eat a variety of foods to provide the body with all the needed nutrients. Third, chew the food thoroughly so that receptors in your mouth can inform the brain what nutrients are coming in, and your brain will reward you with the sensation of enjoyment. When the intensity of that enjoyment goes down, you stop eating, because you don't need any more nutrients from that particular food. If you eat this way, you will know you're providing the body with all the nutrients. But how can you reduce the energy? Before the agricultural revolution, the percentage of food energy from complex carbohydrate during a meal was less than a third of a person's total daily energy intake. However, now it is 50 to 70%, primarily from grains such as wheat, corn and rye, and foods made from flours, grain flours. So, just cutting amount of grains and grain-based foods to 1/2 of what you are eating now, you can achieve the reduced food energy intake. If you do that just for a few weeks, you will know the result, and you can maintain your reduced body weight and your body health for a long time. I wish you all the best. Thank you.